my arms were literally glowing from the inside out. So I'd love for you to talk about the technical piece and how that works.
The light source is this photodynamic therapy that's coming from a cylinder that generates this laser frequency. In cancer, it's usually either red or infrared. So that's the light source,
Yep.
right? And then there's oxygen, because we need air for the fire or air heat to be created. And you were in a hyperbaric oxygen chamber, right? That drives high amounts of oxygen, let's say in your case, into the thymus tumor. So now you have oxygen-rich tumor. The tumors hate oxygen, so it starts to break up the tumor from oxygen too. And now you had the magnifying lens of that sensitizer, and then you put the light in. So it's like a triple threat for the cancer, right?
Welcome to the Forward Think Tank podcast, a place of hope, inspiration, and education around holistic health and healing. I'm your host, Jamie Mazza, a holistic health coach, mental health advocate, and dancer. Join me as I share out-of-the-box conversations with integrative doctors, healers, and exceptional forward-thinking individuals thriving on the other side of their health challenges, as well as stories from my own personal healing journey. Thank you for tuning in. I'm so happy you're here. Hello, everyone. Welcome back to the Forward Think Tank. This week, I have a very special guest, Dr. Leonard Kaplan. He is the founder of OWM Integrative Wellness located in Buffalo, New York, and I had the privilege of working with him last year for a 6-week program that was completely customized to everything that I was going through, aiming to target my tumor cells and help heal my body. And honestly, having that experience with him and keeping in touch with him over the last year and a half, I actually just saw him very recently to help manage some of the nerve pain I've been having post-op. He's a very brilliant, uniquely skilled doctor. He is very kind and it was wonderful. I mean, as again, uncomfortable as the experience can be going through something like this, it's nice to have a doctor, one that you can see in person. He is one of maybe like 4 or 5 at this point, terrain providers that are trained under Dr. Nasha Winters that I was able to see face to face. And there's something to be said for that. You know, he has a very unique skill set. As I mentioned, we used laser technology and light to target my tumor cells. And he talks a lot about that in this episode, which is very interesting and something that I'm all about, because any unconventional healing we can do that aligns with nature and targets what's going on in the body at the root, I am here for it. So fascinating. And honestly, last year when I went to his clinic for 6 weeks, I had never felt better than I did for the entire, year that I was doing all of these treatments conventionally and unconventionally. So not only that, but he has an incredible team and they really made me feel comfortable and like part of their family at a time in my life where I'm going through something that is so heavy and really not enjoyable. So I'm so grateful for his care, for his expertise, and also grateful for the location. I was able to be close to home and family during that time. And I continue to see him and touch base with him, whether that's filling a prescription or touching base on lab work or asking him questions. He certainly keeps the line of communication open and is a very caring doctor. It's been such a blessing to have him in my life. Just to tell you a little bit more about him and all of his accolades, Dr. Leonard Kaplan is an integrative and regenerative medicine specialist. Dr. Kaplan is board certified in physical medicine and rehabilitation and is trained through the American Academy of Anti-Aging Medicine, which is dedicated to the advancement of healthcare technologies and transformations that can combat chronic disease associated with aging. He is a fellow of a metabolic terrain approach to cancer program. Dr. Kaplan is involved with a multitude of forward-looking organizations intent on improving the experience of people and families living with and surviving cancer. The practice was started in 2014 by Dr. Kaplan and his lovely wife, Beth. Dr. Kaplan designed a practice that blends the latest advancements in regenerative medicine, ketamine infusion therapy, anti-aging therapy, functional and integrative medicine, pain management, and integrative cancer therapy. Unlike traditional medical services, individuals can expect a calm and relaxing spa-like setting and hour-long appointments. Dr. Kaplan is a member of multiple integrative medicine professional groups, such as the International Peptide Society, Seed Scientific Research and Performance Group, American Academy of Anti-Aging Medicine, and the Metabolic Terrain Institute. These memberships allow him to constantly update his knowledge and skills and offer his clients the most up-to-date treatment. Dr. Kaplan's expertise in diagnostic and regenerative medicine allows him to use ultrasound diagnostic and guidance skills to accurately place advanced regenerative solutions such as placenta exosomes, autogenous stem cells, and platelet-rich plasma into spine and joints. Dr. Kaplan also designs and oversees integrative infusion services for cancer clients and those seeking infusion therapy for wellness and chronic illness, with a keen eye on developing comprehensive and cutting-edge anti-aging wellness services and programs. Dr. Kaplan's philosophy and professional conviction are to never take the well-trodden path, but instead to always follow the high road that leads to innovation, breaking norms, barriers, and the status quo of conventional medicine. And I couldn't agree with that last line more. He is always on the pulse of cutting edge treatment. And I actually ask him, he's a big biohacker, at least from the way I see it. He walks his talk. He is always physically fit, keeping himself in shape. He eats well. He really practices what he preaches. And I appreciate that so much. I had to sign off on paperwork when I decided to work with him, agreeing to follow the metabolic approach and the keto diet and adhere to carb restriction and really taking care of myself. And that's something you don't ever get with conventional doctors. So I just appreciated that very, very much. It's so near and dear to how I live my life. And I really respect working with a doctor who takes great care of himself and therefore has the energy and the ability to take great care of his clients. It was such a joy and honor to reconnect with him, talk to him about this whole experience working with him and how he really approaches individual patient care and the types of treatments that he offers at his clinic in Buffalo. So Dr. Kaplan, if you're watching this playback, thank you so much for your time. I respect and appreciate you so much. I'm so grateful for you and all of your healing modalities and tools and skills and insights in my life. It has been such a huge asset to have you and have the ability to work with you and have your healing on this journey. So thank you so much for your time. Everyone, I know you're going to learn a ton from this man. So please enjoy this episode and welcome Dr. Leonard Kaplan to the Forward Think Tank.
Hello, everybody. Welcome back to the Forward Think Tank. I am here this week with somebody who has been a very special healer in my life. I want to introduce you all to Dr. Leonard Kaplan. He is an integrative and regenerative medicine specialist, and he is the founder of OWM Integrative Wellness based in Buffalo, New York. Dr. Kaplan, thank you so much for being here with me today. It is such an honor to have you on the podcast.
It's such a pleasure. It really is. Really appreciate your inviting me, for sure.
Yeah, absolutely. Listen, I had such a wonderful experience. Obviously, the reason I was there wasn't the best, but I had such a great experience being in your team's care. I can't believe this is coming up on a year last year, up in Buffalo at your space. I learned so much. You have such a wealth of knowledge and different trainings. So I'm sure it's a loaded question, but I would love for people who maybe are not familiar with OWM and not as familiar with your work to hear it from you. What led you to start this clinic and what are the types of things that you offer at OWM?
Jamie, kind of a loaded question, but a really important one. I think the mission of the clinic is to always get to the root cause of chronic illness or even optimization, right? So we service a lot of different clientele, so to speak, right? So cancer is, of course, a huge project and very, very near and dear to my heart. And with cancer, you're looking at root cause analysis. It follows what we call the metabolic terrain approach, where you're always asking why. Why did cancer happen in the first place? And so that gets to our philosophy, and it was immediately a huge connection with me of why I wanted to start a cancer program at home, because I was already thinking that way. It was a very, very quick, direct progression. I also love challenges, and cancer, of course, if anything, extremely challenging certainly for the person dealing with it, and then, of course, for the provider trying to help the person get through it in the least toxic, most effective way. Cancer is a huge part of our offerings. We have chronic illness from mold to Lyme, something that we would group under mitochondrial dysfunction conditions, things that are causing you to not produce energy in an efficient way, and then creating a slowing down of your metabolism, your ability to clear out toxins and those kind of things, fight off infections. And then there's optimization. So optimization could be everything from improving people's gut health, right, helping them detox, right, improve their longevity, that kind of stuff. So we have something that we call an optimal life program. right, by OWM. So it's basically a yearly membership where they're not necessarily ill or sick people, right? But they're coming in, they're business owners, most of them, just to help them optimize their lifespan and make them better
proactive
community leaders and business owners. And, what could be wrong with that? So a lot of different aspects, but they're all root cause based.
Right.
There's always a commonality there. Of course, we have specific tools that we use for these different populations to kind of thrive and get better.
Yeah. I mean, I was amazed at all of the technology that you have there and the treatment plan in total that you put together for me. So before we get into specific treatment plans for patients and how you customize that, the reason why I had found you initially, I was working with Dr. Lori, Dr. Janet, and we were looking for somebody who had services in person that could really help me for what I was going through at the time, which was trying to help shrink the tumor, clean up my terrain. And they recommended you. I mean, they both recommended you. I then, did my own research and saw that you were also trained under Dr. Winters. I feel so grateful to have your help, to have Lori and Janet's help. I also have somebody here locally who gives me my IVs, and she was just recently trained under Dr. Nasha. So
Right.
What led you to find Dr. Nasha and her metabolic approach?
So that expression, everything happens for a reason, right? So just in general, when you start to offer root cause, maybe you can say out of the box treatment strategies, it starts to attract people to the clinic. Because there's, depending on where you are, there are more or less of those kind of places. Where I am, there are very, very few. So we also have a proximity to Canada. So we have Canadians coming, and we're literally 10 minutes from the Peace Bridge right to Canada from here. So we started to have people coming in looking for cancer alternatives, both from Canada and local. And I was completely out of my depth because that's not what I was doing. But I felt the need to help. I saw a huge deficit in care for people with all kinds of different cancers. And I started researching the way to start learning. And basically there was a introductory IV course, an intravenous course that was run by a naturopathic company. And I've actually taken some courses from them already. This was in Scottsdale, Arizona. So I flew out to take this course. I had no idea who was going to be there. So I got there. It was right at the tail end of the pandemic. So there were maybe 10 people in the room. It was incredibly small. And as part of the Dr. Virginia Osborne, who's kind of like the leader of running these courses, she's there presenting. And then right there along with her was Nasha Winters and Dr. Paul Anderson, who is like a mega mind when it comes to cancer, all in this little tiny hotel ballroom.
Amazing.
With a 10-person audience.
Wow.
So I already knew Dr. Anderson, right? I've never heard of Dr. Winters. And I'm sitting there going, this is just incredibly bizarre that I am here. And there must be a reason for that, right? Because it was just too good to be just pure coincidence. It was almost like meant to be, It was a great course and I learned a lot. And then Dr. Winters and I got to talk. We didn't talk in between sessions, between lectures. And she goes, you should be part of the Terrain Network. And of course, my next question was, what is that, right? And then I joined their cohort, and I went through a 6-month training. We continue to stay in touch. I still talk to her on a regular basis, So usually when you come out of these courses, you become friends with people like that are experts. So they're not just colleagues at that point.
Yeah.
And so that's how that came to be.
It's funny how those things happen because, I've told this story on the podcast before, but when I got diagnosed, which was November of 2023, I remembered learning about like the thymus gland when I was really young in school. And it was something that was supposed to shrink over time and become irrelevant, but nobody knew what a thymoma was. Like it was just very rare. So my husband was in the hospital with me and he went, as we do, we like Google things, and he was looking on Instagram and like put in thymoma into the hashtags and found this guy who had a thymoma, who had a decent following. And he was talking about his experience in conventional cancer care and how it ended up coming back with a vengeance. And then he found the metabolic approach. And so that led us to go down this totally different rabbit hole, which for me very much aligned with how I live my life. I'm a little bit more holistic in nature. I take care of myself. I like to work out. I eat well. So like all these things that made sense to me because I'm a little apprehensive at some of the ways that conventional care really just applies this blanketed approach to what's going on. It's just standard, it's not personalized. So finding this approach and allowing it to lead us to you. And I was like, oh my God, somebody in Buffalo, New York. Like I live in right outside of New York City. There were some providers that were terrain based, but they didn't have nearly as much as what you were able to offer me at your clinic. And I'm like, Buffalo's where I went to school. My family's in Rochester. Like, how amazing is this? And like I said, not only did I have a great experience, I ended up having connections to some of the nurses there. Your team was wonderful and treated me like family, and I'm so grateful for that. I mean, I was feeling wonderful going through all of that, despite some of those large needles with the with the lasers and the photodynamic therapy. But I'm also a sponge for learning, so going through that as much as it wasn't necessarily enjoyable, I witnessed the progress. And of course, we look at labs and different markers. So to see those improve and then to feel the difference energetically in how I was feeling and feel like I was making a difference proactively in my own health and being part of that plan, as opposed to going to the hospital here in New York and saying, okay, you're going to take this drug and you're going to have these side effects and XYZ. It was a completely different experience and one that I was really grateful to have had. So
Well, it was my
I
honor to
appreciate you
offer
very
that,
much.
for sure. I appreciate that. Yeah, very rewarding, and the culture you speak to is so critical to the success of the patients here. I prefer to call folks that are coming in as clients and not patients, because it's a much more holistic attitude that you take towards the individual, right? It's a hospitality model, right, versus a clinical model. So as soon as we talk to our staff all the time about these are clients, right? Like they're coming in, we're meant to be catered to. We're here for them. And that's the hospitality model. We're not doing them a favor. We're here to take care of them. And so the nursing and the front desk, that's the whole goal. Everyone is in that mindset. How can we give you the best possible experience while you're going through these tough procedures? Because these are long days.
Yep, they
right?
sure were.
And right, so and we all know that, and we're getting better at and spacing things out a little bit as well for folks. But the tools are sophisticated, and they're meant to do certain things, and they tend to do them pretty well, which is amazing. But again, in the integrative medicine, there's a concept called optimal healing environment, which is what you're talking about, right? So we just had a training day on Monday. We closed the clinic down to train people, to bring them to our standards, to make sure that we maintain these standards. And part of it is technical skill sets, but part of it is just getting people on the same page of what is an optimal healing environment? How do you contribute as a staff member, right, to this particular concept, which is so critical. And optimal healing environment, you enter the front door before you do anything or talk to anyone. The environment around you already should be conducive to healing, right? And then it should get better and better as you go deeper into the space. So, yeah. So,
I mean, it's so true. I remember one day just kind of playing around. Maybe I shouldn't have been, but I think I asked the nurses, I'm pretty sure if it was okay. The sound bowls were there and I was playing around with those because I know how good that makes me feel. Sound on a whole nother level, that's a whole nother conversation, is so healing in itself. But I also remember, of course, if anyone's going to say yes to this, it's going to be your team. Right. I remember that I first came to the clinic, I think at the end of April. So it was starting to get nice out, and I continued through May. And on those really nice sunny days, as long as I wasn't doing an IV that was photosensitive, which that was very interesting, I remember asking one of the nurses, can I do my IV outside in the sun if it's not a problem? And she looked at me and she's like, I don't see why not. Like, let's just make sure, like Dr. Kaplan and the team are okay with it. But sure, like, there's so much healing in sunshine. There's so much healing in relationships and the beautiful environment that you offer. And so it's all encompassing. And I think that's important. From the moment I stepped in, or even, back up from like the moment I talked to Beth and got myself mentally prepared to come there, it was a great experience from the get-go. So can you talk to me, because I know there was a lot of personalization involved in my plan, as I'm sure there is in every patient's plan, how you go about customizing that for
good question.
a client of yours?
Yeah, I would say that the bulk of the work is done before the person comes in, right? Before the client comes in, because we're looking at all of the labs, all of the imaging. We're talking to you as an individual because what I'm assessing is from the lab standpoint and from the imaging, I'm trying to get a picture of how intensive is the disease process. How far spread is it, right? What does it entail? Because that gives me a sense of, well, obviously the aggressiveness of the cancer, but it also gives me a sense of your body and how compromised it is. So you're always looking at those two together. And the more compromised the body is, then the more work we have to do to prepare that body. And then even whether it's before the treatment, right? And during the treatment. And by the way, mind body. Right. So not only do we want to prepare the body, and we also want to prepare the mind. So that's part of the customization, right? So some of that is just the energy we're getting when we talk to one another, either on the phone, ideally even through Zoom, so we could see each other, or through some kind of a video conferencing device. I get a lot of that information, right? Like the fighting spirit of the individual, because it's it's a battle, right? Cancer obviously is a battle for life. And then when we are asking folks to do more, right, whether you're coming in and tolerating these treatments, right, or we're asking you to change your diet, or we're asking you to take certain extra supplements, right, that's an extra on top of what you're already dealing with.
Oh yeah.
So we get it. It's understood. And then I need to understand, well, how much can I ask of that individual, right? And that changes the program. What's their bandwidth for additional stress, right? So that's personalization, And then, of course, tumor specific personalizations, but botanical supplements. You had a genetic test, cancer susceptibility test that helped a lot, right? That said, this tumor is more susceptible to these botanicals, like, for instance, like hypericin was in there, right? Which is a huge photosensitizer, creates light issues, right, and sensitivities. So which is what you were talking about. But again, so that's personalization on the genetic level, and the tumor genetics, right? And then personalization on the level, well, what light therapies can we introduce that make the tumor more susceptible to different chemicals that we're putting in that are natural substances that can break it up faster? How do we get it there? For your case in particular, when I first was approached by Janet, I said, I don't know how to do this. I don't know how to treat a thymo. And then I went to a conference. I'm a speaker now for this conference with the lasers, the therapeutic lasers. And I was talking to the folks that have been doing this for decades in Germany. And then Dr. Weber, Michael Weber, who's actually invented the Weber system, who is now in his 70s, is a wonderful guy. He said, it's easy. He goes, you just go through the esophagus. And I'm like, we go through the esophagus.
Yeah.
I think the magic of this particular OWM institution is my ability and my versatility in doing almost anything and everything that's medically challenging for a lot of providers, right? So because of my medical background, because I worked in intensive care situations, I worked in hospitals, outside of hospitals, so that technical skill set is kind of rare.
Yeah.
But it allows me to immediately go, well, yeah, I could do that. I've done it before, so it's not like I'm learning how to do it. I just needed to learn how to apply it.
Yeah.
So that was part of your personalization is actually consulting with the German team, and then at least helping me understand the approach to the thymus tumor, which is going to be in your case by swallowing a catheter.
Yeah.
Right.
Was interesting. I mean,
and then illuminating it from inside out, which is brilliant.
Right. Which is wild.
Yeah.
And I have the ability to include photos into the interview. So I'm going to be sure to do that so people can see what we're talking about. Because like I said, yes, this was happening to me, but getting to watch and like take in the whole experience. I mean, my arms were literally like glowing from the inside out because we had these. So I'd love for you to talk about like the technical piece and how that all works. But my arms were like glowing with these lasers. And then we had the I'm forgetting the technical term the little catheter that I swallowed. And then I'm laying on this bed that has the infrared light. I was quite a sight, but it was truly, truly fascinating. So sorry to interrupt you, but I will make sure that we include some visuals so people can reference visually what we're talking about.
Well, your approach, I think, is a quintessential example of how this works. So we could just use what we did for you. And I think it's so illustrative, So that's obviously personalization, but the idea was that we needed to create non-toxic energy inside the tumor that started to break up the tumor itself and certainly limit its aggressiveness and its activity, right? Because you're not only are trying to shrink something, but you're also are arresting its ability to grow and shed tumor cells, which we call circulating tumor cells,
Yes.
into the bloodstream, right? Because then this is how it spreads, right? It's through this invasion into the tissue directly, but also this spread through the bloodstream.
Yes.
So we use a chemical called photosensitizer that could be injected, infused intravenously. In your case, we did that. And then we also can have people swallow photosensitizers, and those can be absorbed separately. And those photosensitizers are, I explain it to folks, it's kind of like a magnifying lens on a piece of paper that the light is shining through. So if you take a light and shine it on a piece of paper on the street, the light will just be illuminated by this light, but nothing will happen, right? You take a magnifying lens like some of us have done as kids, and you put it on a piece of paper. Now the light is being focused as a beam, and all of a sudden the paper gets caught on fire, right? This is kind of what's happening with the photosensitizer in the tumor. So the photosensitizer is the magnifying lens. The light source is this photodynamic therapy that's coming from a cylinder that generates this laser frequency. In cancer, it's usually either red or infrared, right? So that's the light source,
Yep.
right? And then there's oxygen, because again, we need air for the fire or heat to be created. And so you were in a hyperbaric oxygen chamber, right? That drives high amounts of oxygen, let's say in your case, into the thymus tumor, right? So now you have oxygen-rich tumor. The tumors hate oxygen anyway, so it starts to break up the tumor from oxygen too. And now you had the magnifying lens of that sensitizer, and then you put the light in. So it's like a triple threat for the cancer, right? So when you take a green sensitizer called nano-ICG, it's illuminated by an infrared frequency. So now we have you laying on an infrared mat that's shining infrared light through your chest that you're laying on. And we know that infrared can penetrate about 6 centimeters. So it's quite a big distance, right?
Yeah.
Now we have you swallow a catheter, and now we're illuminating this infrared light out of your swallowing tube, the esophagus, into the thymus. And we even did a couple of needles into the sternal bone. And we were shining a light because, again, infrared light can penetrate the bone about 6 centimeters, right? So I knew that just by simply putting needles into the bone of the sternum, it will go through, because the bone is only about this thick, right? You know, it will go through, and the thymus tumor was right on the other side of that. So now we had triple light coming in, trying to get it all absorbed into that tumor at the same time, right? And on top of that, because we just talked about the fact that you have circulating tumor cells that we're trying to get to as well, we can take that same laser and put it as a fiber optic wire into an IV catheter, and now we can illuminate your vein, right? So as the tumor cells are circulating in your blood through the blood, they're getting zapped by the laser that's sitting in your vein, right? So 4 different modalities happening exactly at the same time.
Yeah.
You know, and they're all non-toxic, right? So that's kind of the common, that's the approach. Yeah.
Yeah. So fascinating. I mean, I'm sure you explained that to me at the time, but I was kind of like a deer in the
But
headlights.
you were too much in the process, yeah, for sure. Yeah.
I remember the nurses saying to me, because they would come in and they would check on me because I had to lay there for a little bit like that. And they were like, "You're so calm. Like, are you okay?" I was like, you know what? What else am I going to do? Am I going to sit here and stress that I'm sitting here all poked and prodded, or I can just relax, breathe. I was meditating. I think maybe I had my headphones in. I might have been listening to music. Like, I almost dozed off, which sounds crazy to say because I had like that thing down my throat and, just a lot going on. But I think that is another point to how you want the environment to feel. It's like you want it to be as relaxing as possible. I am a big proponent. I've been working on my mental health for a long time. I'm like, the more I can settle my nerves and calm down and just let this do its job, it's only going to, probably improve the process and make it that much
Yeah.
better. So
Yeah. we're working on improving that too. The work never stops. So this mindful environment, we pipe music into the rooms, and
Oh yeah.
we'll have like essential oils going and that kind of stuff. We have virtual reality sets, which some people like to use as a way of escaping the reality and breaking that. And it's a guided meditation through the
Yep.
VR set. We had to get through some technological issues. We have better sets now that don't feel as constrictive on people's
Awesome.
heads and lighter and stuff like that. But as we are getting our space more and more customized, the idea is to bring in a yoga instructor and do some yoga sessions at the beginning.
Mm-hmm.
Or we have people that come in and do sound bowls. If that's like their expertise, and do like a sound bowl class before the session starts. So I have so many concepts and ideas just rolling them in, but it's all meant to do what you're just saying, right? And you came in as a very centered, grounded individual
Thank you.
with a very strong constitution, and so you drove your own processes like that. But folks a lot of times don't have that, right? They don't come in with that skill set. They need
I
help.
would imagine most people don't.
Yeah, and then so for that, having something already here, including even things like ketamine therapy, right? So ketamine therapy is an amazing holistic tool for cancer as far as working on the PTSD associated with cancer and trauma, the emotional trauma that comes along with that diagnosis. So, a lot of times when people go through treatments, we'll give them concurrent IVs with very low dose,
Mm.
especially when people doing hyperthermia treatments, which are in the dome,
Yeah.
to tolerate the stress of getting to that high temperature. We'll usually
Yep.
run ketamine along with that.
Interesting.
But then we've had a couple of people take advantage of taking like an oral troche and having a psychotherapist come on site and
Oh,
do a psychotherapeutic session with ketamine, right?
love that.
So see the complexity, right, in this rich
Yes.
web of things, of offerings
Yep.
that I'm still perfecting, by the way, right? Like this
I'm
is
sure
very
you
much
are.
a work in progress because the logistics,
Yeah.
right? Because it involves multiple people and people's schedules and stuff like
Of
that.
course.
Talk about nutrition, right? And I think you may have taken advantage of the meals that were prepared, right? Did
I
you?
actually made my own meals. So
Okay.
I was the girl that was like,
You
I'm
were the
gonna
girl that came.
go put this in, the employee refrigerator downstairs.
Yeah, yeah. So,
But
and
I enjoy making food. It's, part of what I do. I coach people around healthy eating for a living. So that was something that was important to me coming in. And you are one of the only doctors I've ever had to sign waivers on to say, like, do you agree to follow this way of eating and like these dietary guidelines, because you obviously understand the benefit of how that's going to help your body heal. And I was like, absolutely, yes. Like, initial no problem. So I did not take advantage of the meals. I know that they were offered, which is amazing, but I did my own
okay,
because I
amazing.
had for months prior been following a pretty strict keto diet. So
For
it
sure.
was something that was already really well rehearsed for me at that point.
Yeah. And that significantly contributed to the success of the program. Because again, you're keto, and I'm sure you talk about this in your podcasts and stuff, but the keto approach, you're doing two things at the same time, which is always the role model for almost everything we try to do. You're depriving a vital energy source of sugar from cancer's ability so that, and grow and spread. And you're also making your own body more resilient with the
Absolutely.
ketogenic diet, right? So you're creating two things at the same time. It's that what Nashel calls metabolic flexibility, right?
Yes.
That flexibility of being able to use your own fat for energy, which is the clean source of energy, and not to rely on sugar.
Yep.
I think is such a huge part because then you have low inflammation, right? You have more energy, right? So you got all these things happening at the same time.
Yeah. Yeah. I mean, when I think back to how strict I was with that, I shouldn't say I'm impressed with myself, but it definitely takes a level of self-discipline, which is tough. I'm now kind of slightly forgiving myself a little bit and being more flexible post-surgery just to, make sure that I'm repairing as well as I can be. But yeah, it's an important part of the process and the metabolic approach. And I certainly saw, to your point, just even in the blood work that we would do on a monthly basis, how well it kept certain markers in check.
Hmm.
Absolutely.
Yeah, for sure.
I know one thing I didn't get the chance to do because of where the tumor is located, and I don't know if you want to speak to this at all, but I know that you do it. And I found that fascinating. I was like, damn, like I wish we could move my rib cage and access the tumor. But I know that you do intratumoral mistletoe injections for solid tumors depending on the location. So I don't know if that's something you do often. Obviously, it depends on the type and the person, and I'm sure a lot of different factors, but I know that's something that you offer as well.
Yeah, so it's an ultrasound guided technique. The classic example is breast tumors because they're so easily accessible, obviously. But we've done it for others as well. And the idea, it's the same Weber needle technology, this photodynamic therapy through a needle, and you actually are putting the needle into the tumor directly under ultrasound. And you're trying to find more active parts of the tumor on the ultrasound and that kind of thing, so you're trying to be as specific or as accurate as possible. And then you can inject mistletoe right into the tumor. And mistletoe in high concentrations has a very good anti-cancer, anti-tumor benefit. But it's now really done as part of a bigger treatment. Right. So we will take a fiber optic wire through the needle and put it into the tumor and do the light therapy inside the tumor. And then as I leave the needle in, I pull the fiber optic wire out. So the needle is still in, and then I inject mistletoe into the tumor. I'm not creating more pokes, which is nice. Right. So it's, there's some efficiency in the process. I use ozone. We inject ozone into the tumor tissue for the same reason that it's been shown to break down tumor tissue and be very carcinogenic as well. So mistletoe, when I started doing these treatments, it was almost exclusively mistletoe. But as I started to get more sophisticated in my approach, I've just combined multiple modalities because again, cancer is tricky, right? It loves to evade and hide and change course. And every time the body has figured it out, the cancer's moving in a different direction, So the more we could throw at the tumor, the better, that's what we're doing. That's what we're trying to do.
I know I almost feel like I shouldn't even say this out loud, but it's an interesting mindset going through what I just went through with the surgery, because like I mentioned to you, the surgeon was like, right now, and I don't even like to say the C word, but like you're free, like you're tumor free. We got out everything we can see. I'm fully aware that stem cells are not always visible, and that, as you are saying, and as Janet said when I interviewed her, it's like cancer is clever. So we just got to make sure that we are not turning a blind eye to it, I guess, and always working on the terrain. And obviously all the work that I've done between working with you and working with her has been very proactive in that effort. But it's like, okay, yeah, the tumor is out. And now how do we continue to keep this body of mine a place where that's not welcome anymore?
Yeah. I think it's
an interesting
perfect
mindset to have.
Well,
as much as I want to be like, yay, it's out.
So it's a critical mindset to have, right? I mean, this is the biggest. Well, there's so many problems with the conventional approach, right? Where do you start, kind of thing, right? But certainly one of the biggest issues with that approach is that conversation that the oncologist will have with their patients, not clients, right? And they will basically say after a course of chemo and radiation, but a lot of times, well, let's say, let's go back to the breast cancer example, after a mastectomy, you're free. You never have to worry about it again. And that is one of the worst things you could possibly say to the person, because it sends a message that they can just go back to the lifestyle that a lot of times led them to have that cancer in the first place, right? And this is what I see and a lot of my colleagues see. So a young woman, let's say, goes through a double mastectomy. She's told that she's free and clear, right? And she is at the moment, right? And then she goes back and the diet is not right. The exposure to environmental toxins is not right. Maybe there's not enough stress reduction. Maybe they're not paying attention enough to their mental health. And then lo and behold, 2 years later, the cancer comes back to bone, to brain, to lung, right? This is where breast cancer goes. And the question you say to yourself, like, well, did that oncologist do a huge disservice to that woman by telling her that she's free and clear? And the answer is yes. It's not even a question mark, right? It's a huge disservice, right? Because unfortunately, you want to say that because you want to let the person feel like you're good to go, but it's a false security, right? It's not true. So even though the reality is sometimes hard to take because that means the person has to continue living a certain lifestyle essentially forever, right? That's
Yeah.
it's hard to take, right? Because you kind of
Yeah.
want to be over and done with it,
Right.
But once you understand that and you come to terms with it, right? Then you thrive within that new model,
Yes.
that model of your body, that view and approach of your body,
Yeah.
right?
Yep.
So.
It's so true. I mean, the quote that plays over and over in my head is like, you can't heal in an environment that got you sick. And so I have been forced to examine a lot of different things in my life because people were like, oh my God, Jamie, like you're the healthiest person I know. You were always physically fit. You danced your whole life. You eat really well. Like, yeah, but there's so much more to it than just that. And this is why I have really leaned in so much to the metabolic approach and the whole idea of terrain, multiple terrains, knowing what I know about my own health. And also to your point, like environmental factors and stress is a big one, especially living in the greater New York City area. It's like we're all just constantly like turning and burning. So it's forced me to make a lot of needed changes in my lifestyle. And I hope that just continues to support the healing process for me because to your point, it is something that you need to continue to, I don't know what the right word is, just
Oh, you thrive in that.
continue to thrive. Yeah,
This is your
continue to
place
work
to
on.
thrive. It's not a limitation. I think we always talk about, flipping the script, right?
Yep.
Or I love, this is based on the title of the book called How to Change Your Mind, right? You're familiar with the book, I'm sure. And I love that, right? Like changing your mind, right? But not changing your mind in the moment, but
Yep.
changing your mind as a permanent change of your
Yes.
attitude. So I use that, plagiarize that all the time. I talk to people, we need to change your mind,
Yep.
right? Like, and once you've changed your mind, then it's certainly, if no longer a hardship, it's definitely much less so of a hardship.
Mm-hmm.
It's just the way you live,
Yeah,
right? It's just
absolutely.
the way you live. And I think it's incredibly important to do that, because even taking our conversation outside of cancer, of just even going to something as common as dieting and weight loss, right? Look at diet plans never work
Right.
because the person's mind never changed,
Right. It's like, let me
right?
do this. It's short term. And then I can
Yeah.
go back
Go
to
right back. And
the way
of
things
course,
were. Yep.
what do you think is gonna happen when that happens, right? You shed those pounds and they're gonna come back. So yeah, cancer is a much more sophisticated and much more complicated topic, but really that buy-in that you've had where you've changed your mind, and I don't think I mean, you had a little bit of a shorter journey because you're already so health conscious
Yeah.
and health oriented to begin with than some of the other folks out there, but it's a journey that's so important to take.
Yeah. Yeah. I mean, it's really forcing me to walk my talk, for sure.
Well, you're also being a role model for other people, which puts you on the
Yes.
spot even more.
Yes. Yes. And that is why, I, especially after going through the whole experience at home and feeling really good and seeing promising results, and I started getting so many questions. I'm like, I'm going to start a podcast. This is what it's going to be about. I'm going to talk to, God willing, these doctors are willing to talk to me. I mean, I've built pretty good relationships with all of you, and I'm so grateful for it. I also want to get to a point where I interview more, patients, I guess, clients, humans, people who are like on the other side of their diagnosis, because I think one of the things that is the most isolating is feeling like you're alone and this is like a punishment and it's never going to be better. It's so dark and daunting. But what I chose to do, and especially in finding the metabolic approach, you find a lot of people who are empowered on their own and then just really kind of gain that momentum and education from having providers like you help them heal, learning from them and using them as a role model to say, okay, well, healing is possible. And here's how I'm going to go about doing it. And a lot of it probably is the mindset. I wholeheartedly believe that, because I say to everybody, if this happened to me 10, 15 years ago, I was super anxious. I would get depressed a lot. I mean, there was, just my stress levels were whatever. I was a different person. And so I would not have handled the situation
Uh-huh.
as I have now.
Mm-hmm.
But now I know what I know, and I'm, at a completely different point in my life. But that's why I really found it important to have these conversations and have a platform for people to learn from who are looking for non-conventional, more integrative treatment and other ways to help themselves, because I think it's so important and it's not talked about enough.
Yeah, completely agree.
But I do, I want to be mindful, of course, of your time. I know we've talked about a lot, so I feel like we've covered a lot of my questions, but I'm so curious for somebody like you, because I know that, speaking of walking your talk, you absolutely walk your talk. I see you, in what's shared on social media, just knowing you and having worked with you for 6 weeks. I know that you are very physically active. You take care of yourself. I mean, at one point you told me, or somebody told me, that you like get in the hyperbaric oxygen chamber regularly. So what are your favorite, if you want to call them, biohacking tools for health and longevity, and why are they important to you?
Well, yeah. So I think diet is number one for sure. We just talked about that. So I intermittent fast, very, very low carb. I don't necessarily follow ketone numbers, but I'm in a very low carb diet. Routinely, I may have a cheat day here and there,
Yeah.
gluten free mostly. Again, for a lot of reasons. I don't have a gluten sensitivity, but diet is a huge biohack, right? I love light as a biohacking tool. So I have a band that I use. So the same company that has the big machine has a light band that you could put on your wrist, and it radiates the laser. There are 6 frequencies, and you could take a botanical drink or a supplement, and it will activate that drink. So I'll use that for energy recovery, repair, and that's
Cool.
definitely a favorite biohack of mine.
Yeah.
So I'll use it to fly on planes. It reduces jet lag. So
Wow.
red light is very activating and helps recovery and repair. Yellow light helps detox.
Yeah.
So light therapy in general is a favorite biohack.
Yeah.
The other one is oxygen therapy. Oxygen therapy, whether in the form of ozone or hyperbaric oxygen, has been shown to prolong longevity, reduce inflammation, improve energy production. I don't know if you call exercise a biohack. It has to be, So I exercise 5 days a week, and variety is a spice of life. So
Yep.
I have 2 very heavy weight train days. I
Okay.
have 2 yoga days, and then I do something that's called electrical muscle stim. Are you familiar with that exercise?
I can
So you
imagine what it is, but
you
I don't
wear a
know
suit. It's
specifically.
called EMS.
Okay.
You wear a suit. It's a little bit of a self-torture kind of thing.
Okay.
So the suit has sewn in electrodes, and you do that with a trainer one-on-one, and they turn up the electricity, and it makes the muscles contract, and you do that. You have a glute or butt strap, leg straps, and arm straps, and I do that on Fridays to kind of round up my week of exercise.
Yeah.
And then your whole body, you get a workout in about 20 minutes or so. So
Wow.
it's like a way for me to hit all the different muscle groups. And
Yeah.
it allows you to exercise with low resistance, low weight, because you're working against your own muscle contracting as a resistance source.
Cool.
Love that biohack. It's
Yeah.
absolutely
That's
incredible.
interesting.
So those are my favorite biohacks, and of course supplements depending on what I'm looking for and looking to do. But
Yeah.
those are big ones.
Yeah. Awesome. Thank you. I mean, always learning from you. I feel like I don't want to say I look forward to coming back to the clinic for reasons why I have to be there, but I look forward to visiting again and seeing all that you've done since I was there last. And of course, like we talked about before I started recording, maybe doing some things to help with the nerve pain that I've been dealing with. So you're somebody who is so inspiring, because I feel like you're always learning and you're always problem solving. I remember saying to you, you've never done a thymoma before. Do you feel confident in this? And there's something to be said for confidence, but I think also your experience and knowing that, having the conversation with Dr. Weber and, thinking about it in a different way, and using the experience you had and really making it as seamless as possible for me. I'm so grateful for that, because am I wrong in saying that you're the only doctor in the US that has the Weber technology, or uses the Weber technology?
No, I'm one of the few, but there are others for sure. Yeah, I mean, there are some folks in Florida. What makes me unique, and one of the reasons why I'm a speaker for their company, and I just present during these conferences, like there was just one in San Diego last 2 weekends ago, is because I could use light therapy for muscle repair, injuries, and cancer. You know,
Mm-hmm.
and it's the precision of placement and an ability to use ultrasound. It's that combination that makes me pretty unique. There are probably only a handful of people in the whole country that can do that level, that have that level of sophistication.
Got
There are some people that have the machine that are using it for wellness, that could maybe put as an IV in the arm, but it's that comprehensiveness of the approach that's fairly unique. Yeah.
Gotcha. Truly fascinating, honestly, and very unique experience. So, well, I want to be mindful of your time. So I ask everybody who comes on the podcast, because it's the Forward Think Tank, one final question to wrap. So what is it that keeps you moving forward in life?
In pursuit of knowledge. Yeah. So that is something that it will probably never end. And that's what separates, I think, me from some other folks too, is that I can never be doing the same thing for longer than 6 months without feeling like it has to be improved upon.
Yeah.
It drives my staff absolutely insane.
I can imagine.
But that's what keeps me going. That's what gets me out of bed every day.
That's amazing. And you know what? It's a growth mindset, and I don't think that everybody thinks that way, but I think it's a really wonderful thing when you look at life that way. And I think it continues, I'm sure, to keep things interesting, but also I would argue, in terms of like biohacking, it's something you're constantly using your brain, so it's also keeping you young.
We'll have to think that.
I think so. I just interviewed my surgeon, who was another wonderful human that we were very fortunate to find. It was not who we thought we were going to go with originally. And I asked him a similar question, and, it was just constant improvement, constant learning from, in his case, all the surgeries, because not any one case is the same. And I'm sure you can say the same thing. The mindset to constantly learn and constantly grow and be better is just something that's really admirable. And so
Well, thank
I love
you.
that.
It's an honor to be part of your journey. I mean, for real. So let's keep going,
Yep. That's right. Well, I appreciate you so much. I can't wait to share this interview. Hopefully we didn't leave anything major out, but I think a lot of people will learn from this. I will certainly include links to your site and how to get in touch with you. Is there anything you feel that we left out? Just final closing comments?
Yeah, I just in the process of improving the facility. We're starting on a recovery zone in the basement that will have 2 flotation beds, like a dry sensory deprivation,
Awesome.
a
So good.
hyperbaric oxygen, infrared sauna, cold plunge,
Nice.
and an altitude trainer. So it activates mitochondria by depriving you of oxygen or lowering your oxygen and then increasing it in a cyclical manner. And that's going to be open to anyone who comes in and participates, and stuff like that. So that's a way to really work on the body in a more wellness manner. So I'm excited. That's the next chapter for us as far as
fantastic. That's so exciting. I mean, I can only imagine, how different things are going to feel when I walk in the doors next, whenever that happens. But awesome. Very exciting.
You, appreciate it.
Thank you so much. I'll talk to you soon.
We'll talk soon. All right. Take care.
You too.
Did you enjoy this episode? If so, I would appreciate you taking a moment to please leave a 5-star review. Every review helps visibility with this episode to reach more people, and I am on a mission to help people learn alternate resources to support themselves in their healing journey on their road to health. So please take a moment to leave a review, leave a comment. I read every single one and I respond back. And of course, the most helpful thing you can do is to share this episode. If you found it helpful, if you found it entertaining, please share it on social media, send it to a friend, a loved one, someone you think could find this helpful. It means the absolute world to me. Thank you so much for being here. Thank you for listening, and I will see you soon.